Hi all, I'm Dr. Malati working as a professor in Trippuram College of Nursing. So in this video, I'm going to discuss about Ventouse. The objectives are introduction, definition, equipment, parts of vacuum, types of cup, indication, advantages of Ventouse over forceps, advantages of forceps over Ventouse, contraindication, prerequisites, procedure, complication, failure, summary and conclusion. Introduction. Ventouse delivery is also known as vacuum assisted delivery, and it is a type of assisted vaginal delivery in which a suction cup is applied to the fetal head to help guide and deliver the baby during the second stage of labor. It is performed when there is a prolonged labor, maternal exhaustion or fetal distress, and when shortening of the second stage of labor. The procedure is carried out by the skilled obstetrician under strict conditions and also to ensure the safety of both mother and baby. Definition. Ventouse is an instrumental device. It is designed to assist the delivery by creating the vacuum between it and the fetal scalp. Equipments. The Ventouse R vacuum extractor consists of the following basic components. First is suction cup. It is available in 4 sizes: 30 mm, 40, 50 and 60 mm. A vacuum pump and the traction rod device. These are the parts of vacuum: vacuum pump, cup, vacuum bottle, pressure gauge, rubber tube and traction rod. Then regarding the equipment, it is a modern vacuum extractors used as an electrical pump which has sensitive controls. The vacuum is built up steadily here and it is maintained efficiently so that the cup is less likely to come off. It has a metal or firm rubber cup and it can be applied to the fetal head so that the vacuum is created inside this cup, which is connected to the pump by rubber tubing, and traction is then applied. Inside the rubber tubing, there is a metal chain designed to take the strain of traction with the metal hand to give the operator a good grip. Types of cup. There are 2 types of cup. One is rigid cup, another one is soft cup. Indications. Deep transverse arrest with adequate pelvis, delay in descent of high head in case of second baby of twins, malpositions like occipitolateral and occipitoposterior, delay in the second stage of labor as well as late first stage of labor, and we can use it as an alternative to forceps operation except in phase presentation and after coming head of breech, fetal distress or prematurity, maternal exhaustion. Advantages of Ventouse over forceps are: the Ventouse can be used in unrotated or malrotated occipito-posterior position of the head. It can also applied even through an incompletely dilated cervix. It is not a space-occupying device and it needs only lesser traction forces up to 10 kg. It can be used safely even when the head remains at the high level in the second baby of twins. It is also comfortable and injuries to the mother are very less. It requires only less technical skills for the operator. Advantages of forceps over Ventouse. Forceps operation can quickly expedite the delivery in case of fetal distress, where Ventouse will be unsuitable as it takes longer time. Forceps is safe for the premature baby. The fetal head remains inside the protective cage. It can also be employed in anterior phase or in after coming head of breech. In suspected pelvic contraction where moderate traction is required, Ventouse will be ineffective. Contraindications: fetal distress, phase presentation, prematurity and fetal bleeding disorder are the contraindication for Ventouse. Conditions to be fulfilled: there should not be any bony resistance below the head and the head of the singleton baby should be engaged. Cervix should be at least 6 cm dilated. Prerequisites. Prerequisites are as follows for same like a forceps delivery. Here the operator must be completely familiar with the technique appropriate to the particular cup design. So the woman should be positioned in lithotomy and prepared as for forceps delivery. So the position of the fetal head should be determined and an appropriate size and type of cup should be selected, followed by pudendal block or perineal infiltration with 1% lignocaine to be given. The instrument to be assembled and vacuum to be tested prior to its application. Procedure. So there are two steps in procedure. Step 1 is application of cup and step 2 is traction. First, step 1, application of cup. Here the cup is introduced after retraction of the perineum with 2 fingers of the hand. So the cup is placed against the fetal head near to the occiput with the knob of the cup pointed towards the occiput. So this will facilitate the fluxion of the head. The vacuum here initially 0.2 kg per centimeter square is induced by hand pump slowly. It will take at least 2 minutes. Then we have to check with the help of the fingers round the cap to ensure there is no cervical or vaginal tissues are trapped inside the cup. Then the pressure is gradually raised at the rate of 0.1 kg per centimeter per minute until the effective vacuum of 0.8 kg per centimeter square is reached in about 10 minutes duration. The scalp is sucked into the cup and an artificial capute with succedaneum is produced. So once it happens, the chignon usually disappears within few hours. Step 2 is traction. Here the traction is exerted usually one hand in the direction of curve of Caros. The traction must be at right angles to the cup and synchronized with the uterine contractions. So while applying the traction, the fingers of other hand are to be placed against the cup to note the correct angle of the traction, rotation and advancement of the head. Here in the Ventouse delivery, it may take slightly longer than the forceps delivery. However, if there is no advancement during 4 successive uterine contractions means the procedure should be abandoned. So, on no account, traction should exceed 30 minutes. So, these are the 2 steps for Ventouse application. So, as soon as the head is delivered, the vacuum is reduced by opening the screw, release valve and the cup is then detached. The delivery is then completed in the normal manner. Coming on to the silicone or silastic rubber cup. So silicone rubber cup, it can be replaced in the place of metal cup. So this cup is used when the mother is cooperative, the baby is average size and there is minimal capute. Silicone rubber cup is used in the following manner. It has to be folded and gently inserted into the vagina with one hand from above downwards while the other hand should separate the labia. A gentle twist after introducing, a gentle twist may help it to unfold it into place in the vagina and thereafter it is essential, not maneuverable, being larger in diameter than the metal cup and having a relatively inflexible handle. With a pressure of 0.2 kg per centimeter square, a check is made to ensure that no maternal tissue caught under the cup and then the pressure is raised to 0.6 to 0.8 kg per centimeter square depending on the size of the baby or weeks of gestation. It is gentle to moderate traction along the pelvic axis for the duration of next 2 to 3 contractions should deliver the head. So one hand should rest on the bell of the cup while the other hand should apply the traction. The hand on the cup detects any early detachment and also indicates whether the hand moves downwards with each pull. The fingers on the head can promote the flexion of the head. Coming on to the complications, maternal complications are trauma to the mother. Injuries may occur due to inclusion of the soft tissues such as cervix or vaginal wall inside the cup. Fetal complications are sloughing of the scalp, cephal hematoma, Cerebral trauma, chignon. This is an area of edema and bruising where the cup was applied. All babies delivered by Ventouse will have a chignon. These normally subside uneventfully but may occasionally become infected. Failure. An attempted vacuum extraction may be unsuccessful. Exerting too much traction will result in the cup coming off. The cup is likely to come off in unskilled and impatient hand. Summary. Ventouse delivery is a vacuum-assisted vaginal delivery used during the second stage of labor to help deliver the baby when there is prolonged labor, maternal exhaustion, or mild fetal distress. A suction cup is applied to the baby's head and gentle traction is given during contractions. Here, the nurses plays an important role in preparing the mother, monitoring the fetal heart rate, assisting the doctor, maintaining asepsis, and observing both mother and baby for complications after delivery. So, proper care ensures safe maternal and neonatal outcomes. Conclusion. Ventouse delivery is a safe and effective assisted vaginal delivery method when used correctly. Nurses should play a vital role in preparation, monitoring, assistance during the procedure and postnatal care. Early identification of complications and proper documentations are essential. With skilled nursing care, Ventouse delivery can result in good maternal and neonatal outcomes while reducing the need for cesarean section. Thank you.